Okay, we're gonna get started now. Hello, everyone. Welcome to the ICFJ Global Health Crisis Reporting Forum. My name is Erik Robelen, and I'm thrilled to moderate this webinar by ICJF. I'm the Deputy Director of the Education Writers Association. Our members include journalists across the US and some abroad who cover education. I'm also a former education reporter and editor myself. And I've been invited to the forum by ICFJ to host this webinar on covering COVID-19 and education. What's the future of school? If you're joining us from Zoom today, please submit your questions on the Zoom chat, which you'll find in the menu options below. If you're watching from Facebook live stream, please post your questions in the comments below the video. So we have a stellar lineup today with two outstanding experienced journalists and a longtime education expert to help you get a global perspective on the impact COVID-19 is having on education across communities, countries, and even continents, and what the response looks like. After all, the coronavirus pandemic is not just a public health story, it's also a huge education story. Frankly, the biggest story on the education beat I've ever seen. Our core objectives today are to help you, the audience, better understand what's happening and to provide compelling story ideas, including on underreported issues that can be pursued in virtually any country or community. On the panel with us today, we have Emiliana Vegas, who is a senior fellow and co-director of the Center for Universal Education at the Brookings Institution in Washington. A leading expert on education in developing countries, Emiliana's focuses primarily on education in Latin America and the Caribbean. Her papers and books address teacher effectiveness, school finance, early childhood development, and more. We also have Chika Oduah, who is a Nigerian-American journalist who works as a television news producer, writer, photographer, and correspondent. She's received numerous awards for her work, including a CNN Multi-Choice African Journalist Award in 2016. She's worked in the journalism industry for nearly 20 years and currently reports for Al Jazeera, Voice of America, and other news outlets. Finally, we have Antônio Gois, who's been an education reporter in Brazil since 1996. He writes a weekly column about education for O Globo newspaper based in Rio, and he's also a consultant and education columnist at the cable channel Futura. In addition, Antônio founded Jeduca, which is the Brazilian Association of Education Reporters, which I understand was inspired by the organization that I work for in the US. He's won Brazil's highest journalism honor, the ESSO Journalism Prize, twice for stories on education. So welcome to all of you. I want to start just to quickly orient our audience. Maybe if each of our presenters can just tell a little bit about your role in covering or studying education in the pandemic. Why don't we start with you, Chika?
Hi, everyone. It's such a pleasure to be with you all. I'm so excited to be part of this very important topic. I think it's really good for us to contextualize education in a global international space because, of course, we're dealing with a pandemic that we've never seen before. And education plays such a huge role in that. I just want to bring up the fact that just a few days ago, several world leaders, I think about 200 world leaders or so, actually wrote a letter trying to call for international bodies to really look at education. Erik, perhaps you saw this letter that went out, pretty much a plea to the global community to say, hey, we've got to make sure that we don't lose an entire generation of students to COVID. So I want to bring that conversation into the framework. It's really important. But for me, I've really been taking an overall view at Africa, from my current base in Atlanta, Georgia, and just monitoring all of my contacts, all the relationships I've been building and nurturing over the past few years as a journalist operating in Africa. to really try to have a bird's eye view of what's going on. And I've really used social media to spread the message. You know, whatever I'm hearing on ground, I go straight to social media to help to contextualize what I'm hearing. I'm really covering some of the hotspots. When I talk about hotspots, I'm talking about countries in Africa that are kind of shining stars when it comes to education. So I'm talking about South Africa, I'm talking about Nigeria, Kenya. And when we talk about Francophone Africa, the French-speaking African countries, Senegal always stands out, Cote d'Ivoire always stands out. So I've really been looking at these countries because they have reputable education systems. You know, they've done relatively well in trying to boost, you know, education for the young people who live in those countries. And these countries are really on the front lines of trying to have a collective emergency response to how to deal with COVID in the classrooms. So those are the countries I've been monitoring for the most part.
Okay, great, thank you. Antonio, just tell us a little about your role in covering this unprecedented moment.
Yeah, as you told on my presentation, I am an education columnist. So most of my work is writing for the Globo, which is one of the biggest Brazilian newspapers. And of course, I've been talking a lot about the effects of the COVID in education, and especially from a Latin America perspective. We're talking about not only a country, in my case Brazil, but as a whole continent, where we have huge problems of inequality. Inequality, of course, is a problem all over the world on this crisis, but considering countries in Latin America, where we have the highest level of inequality in the world, this is even worse. So this something that every education reporter in the world, I think, it should be aware of. In the case of Latin America, this is even more pronounced, even more important because we have, for instance, right now we're discussing in Brazil if private schools should return before public schools because they are more prepared. Because so this is not only we will face emotional losses, learning losses, but also the impact on inequality in a country such as Brazil, and I think I can talk for all Latin America, will be huge, 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 and we have to address that. And this is something that I'm really concerned. And also at Jeduca, the Brazilian EWA, we also are discussing a lot how to help reporters to deal with this and other issues in education during this crisis.
Thank you. And I'm just going to chime in there to that last point, because I'm sure our audience is aware of this. Another of the impacts of the coronavirus pandemic and recession has it's really hit the journalism industry. I know in the US, and I have to imagine that's true in many other countries as well. I mean, I know of reporters I know personally who've been furloughed, some have been laid off. So that's a really distressing situation as well. Emiliana, tell us a little bit about your work in this right now. It sounds like you've been producing some reports and analysis and presenting about what's going on and helping us see some, cross-referencing across countries.
Thank you so much, Eric, and for EWA and all of you for having me here. So Brookings is devoted to providing research evidence to inform policy. And we are a research institution, but we are very much about having impact. And so in that vein, we had, a long program on research for education policy, but when COVID hit, we obviously had to turn our attention to how it was affecting the opportunity for learning across the world. Our mandate is also global, so I've been doing different things. One of the first things I did was with colleagues from the World Bank was to try to estimate what may be the impact of the learning loss in productivity in the United States as well as across the world. I also did a piece trying to understand how are governments responding to the need to provide continuing learning opportunities in the after they had to close schools down, and basically found huge inequalities between countries that are high-income countries and low-income countries, between regions, where sub-Saharan Africa being much less able to continue to provide learning opportunities to their students because of the lack of access to electricity and internet connectivity in many of these countries. And then as Antonio was saying, a big focus on inequality and how within and across countries, the impact on education systems really is having unequal effects.
Okay, thank you for that. Emiliana, just to piggyback, one question, this is sort of a bigger picture, and then I'll ask the other two speakers to chime in as well. Across countries that you're studying, to what extent are schools open? Are they, is everyone learning from home? Is there some kind of hybrid situation? Maybe it's a mix of all of the above, like it is here in the US, and frankly, check the time of day, and there might be another system who has changed its plans. But what generally are you seeing across countries in terms of whether there's some kind of education happening, and if so, in what form?
So what I'm seeing is that countries that have been able to control the pandemic at a significant level have been able to reopen and remain reopened, right? Countries that prematurely reopened schools before the pandemic was well under control, and some say the threshold is 5% of new cases. I'm not a medical expert, but have had more issues where they have reopened but also have had to close. Overall, we were talking about this yesterday. Some countries have announced that they're not going to reopen until 2021, Kenya being a primary example, and declaring that 2020 is basically a lost year in terms of learning. And other countries, they haven't, Latin America, I think the exception is Uruguay, that reopened in full in June. And it had, again, the pandemic under control by then, and it's had some cases, but in general, it's been able to maintain the schools open. So a lot of variation, but I would say mostly it's the Nordic countries that have been able to reopen safely, some East Asian countries, and very few countries in the developing world, unfortunately.
Mm-hmm. I just heard a news story this morning, not about the schools, but about in South Korea, that they're seeing a rise of COVID-19 rates. That's been sort of one of the shining pillar examples of how to do it right in terms of, it seems, the public health response. But I'm sure that's worrisome there, and maybe to people in other countries. Antonio, so to drill down a little bit in Brazil, is there a lot of variation in, open in person, online, some mix of the two?
Yes, just like the US, we have a system that's it's a federation of states. So each state and each municipality, even more, we have more than 5,000 municipalities that have control for their local schools, 27 states that have control for their schools. And we also, as a big country, just like the US, we have situations like the situation of the pandemic in São Paulo is different from the north of Brazil. So when you look to the figures of the average of Brazil, you have a lot of mixed movements on the stages of the crisis. So this brings an issue that it's sometimes difficult to people understand, and to the way that we report, because we are reporting averages of the country. That makes a confusion on the discussions. But so far, Brazil also has almost quite few systems has already returned. The north of Brazil, the Amazonas, a state on the north of Brazil, has already returned in some cities. We have some governments making announcements recently about that what day they will reopen. For instance, at Rio de Janeiro, they allowed yesterday, the private sector to come back, and they will come back first. So This is an example of how this can bring issues of inequality, because affluent families who have been already having a better experience considering the pandemic, they will return first to in person. But there is still, in Brazil, there is a lot of insecurity. The parents, the latest national poll showed that 76% of the parents don't want their child to come back to school. So somehow they don't trust the authorities, and even if when authorities are saying that it's safe to return under the conditions that they put as effective, even on those situations, people do not trust. So for us in Brazil, and I think we can talk about every developing country, that one of the big issues is that we have few examples of countries, developing countries or poor countries, that has already doing this movement. Emiliana mentioned Uruguay, which is in Latin America, of course, but it's a small country in Latin America compared to Brazil. And of course, we are looking for what Denmark or Finland or UK is doing, but it's so different, the level of development, the level of investment per pupil in education, that it's hard to have international references without considering the level of development of each country.
Right. Yeah, no, that's so important. It makes this a rich conversation, but a tough one, because I also want to be really careful of not generalizing across and within countries. And, even within your country, as you're describing, there's incredible variation. I can tell you in the US, I mean, there's a million stories, and the situation is so different. And even, the ability to cope with the situation can vary widely. I wanted to just put a pin on this issue of, as far as story ideas. I'm glad you mentioned a parent survey. I just want to say to the audience out there that surveys are such a powerful tool. And it, it's easy to generalize or get a sense, but this can give you some data that, if it's a well-conducted survey, can give you some greater confidence and can be a great springboard for stories. Both what are parents saying, and a lot of places might have surveys of parents and teachers, and how are their responses different, their level of comfort with returning to school, their concerns and so forth. There's can be a lot of great stories about where their feelings and perceptions align and where there's tension. Because there's inevitably going to be tension between those who are teachers going into work in schools versus parents who, feel this burning desire, if it's safe, to have their own kids in school. So at times we've seen in the US where there's some tension there. Chika, I wanted you to say a little bit about when we spoke previously. You told me about how you're seeing both creativity and some innovation happening in certain places in Africa, and then you're seeing another example. And I'm trying to remember, Kenya, where you said they declared a lost school year. Could you start by telling us about how Kenya came to that decision and what that means, but then can contrast that with the creativity and innovation? Because I think another thing just for reporters is I know there's always this urge to kind of tell the most distressing story, and we don't want to shy away from that. That's so important. But it's also, the public needs to know also about the positive and encouraging signs too.
Sure, thanks for that. Emiliana alluded to this earlier about Kenya. So Kenya, the government has really taken what I would call a very heavy-handed approach to trying to control the pandemic. So far, there are about 31 or so thousand cases of coronavirus that's confirmed, 31,000 in Kenya. So still a bit on the low side. And so the government, as I mentioned, they've been quite heavy-handed. They've state police forces, videos have emerged of police using tear gas, using whippings, beating people to disperse crowds. So they're really, really quite serious. And so in July, the government said, we're going to just scrap the school year altogether. They were trying to actually go with digital learning, homeschooling. But some of the parents, the level of education that parents have, it's so wide, and some of them are not very well educated, so they couldn't really help their kids try to tap into the virtual learning or try to get into homeschooling. So the government said the inequality is just too wide, let's cancel the schooling altogether. And also getting kids access to computers, it was pretty much infeasible at the time, so they pretty much said no school. And this affects 18 million young people across Kenya. This is from primary education all the way up to high school into college. This also includes the 150,000 young people living in refugee camps. Kenya houses a lot of refugees coming from nearby countries, running away from conflict areas, especially Ethiopia and South Sudan. So no schooling for those kids. And a lot of people have described this step as drastic, as unusual, because other African countries are not trying to do that. They're trying to at least have digital learning in some way. But to take this huge step is, it was quite shocking to the Kenyan people themselves. And the aftermath of this, I think it remains to be seen, because a lot of the private schools are quite concerned about not having their revenue. And so 25% of schools in Kenya are private schools, because there's no way the government schools can really meet the needs of the entire population. Unfortunately, government schools are overpopulated and underfunded. Classrooms are looking at maybe 100 people in a classroom. So private schools, not only in Kenya, but across Africa, play a huge role in trying to meet that education gap. And so some schools in Kenya, private schools, have actually said, we're not even going to open in January. So this really, really speaks to the larger future. And it looks like a pretty bleak future in terms of education in a place like Kenya. And Kenya has really done a great job trying to build its reputation as a shining star for education in Africa. So this is quite a worrisome trend. And one of the trends that we're seeing is teenage pregnancy. It's skyrocketing in Kenya in the past few months. The Ministry of Health came out to say that. I mean, if you look at the Kenyan local media, you're seeing numbers like 4,000 girls getting pregnant during this corona lockdown. And so some people are trying to link this to the lockdown. Kids are out of school. There's not a lot of sex education. Some of this could be attributed to sexual assault. So, the repercussions of kids not being in school, it's huge. And to see teenage pregnancies skyrocketing like this in Kenya, it's quite worrisome. I mean, can the Ministry of Education and Health handle this? But in terms of innovation, yes, we're seeing some really cool stories. Nigeria, which is where I'm from, is really trying to take charge, especially in the private sector and the non-governmental sector. So there's one organization called Slum to School, and it was started a few years ago by a young Nigerian who decided to quit his job as a banker. I think he's in his early 20s. And he said, you know what, I'm going to work for education. So he's found a way to provide virtual learning to almost 1,000 young people across rural communities in Nigeria, pretty much in Lagos, which is the most populated city in Africa. We're talking about 20 million people in Lagos. I mean, that's bigger than the population of New York City. So he's giving these young people a chance to kind of tap into virtual learning. Some of them have 3D headsets. And there's a picture going around that went viral of him, this young man, in the operating room looking at the screen. So that picture in itself is a very powerful representation of innovation in the educational space in Africa. And also looking at robotics. Rwanda and Senegal have really been testing the use of robots. Rwanda has been exploring using robots in classrooms for a few years now, so nothing new for Rwanda. And the robots have not yet been deployed into the classrooms, but they're working towards that. So far in Rwanda, they're using them in hospitals, using them at the airport, the Kigali International Airport, and there are talks of trying to get them into the classroom as well. And we're seeing robots not just in Africa, but in Japan. I mean, in Japan, they were using robots to replace students for their graduation this year. So I think we're going to see a lot of robot activity in the next coming months.
And why robots as teachers? is that out of health concerns for having teachers in person, or?
Yeah, it's definitely health concerns. And in Senegal, students were actually the ones building the robots themselves, which is really cool. So engineering students were looking at this and trying to see what needs could be met in terms of education and public health with the robots.
Okay, okay. In the US, reopening schools itself has become a highly politicized issue. President Trump for some time has been tweeting and placing pressure on school systems to open for in-person instruction. Some people haven't found that to be all that helpful. You know, when this becomes politicized, it certainly complicates the situation. Antonio, you were mentioning to me that that's a situation that's arisen in Brazil. Can you talk a little bit about that and the implications?
Sure. Yes, it's amazing the Brazilian capacity of copying every stupid debate that's happening in the United States, every stupid idea that we, and we have a president, President Bolsonaro, who is quite similar in many ways to Trump. And this is a big issue in Brazil. I mean, even like you have the issue of Trump defending the hydroxychloroquine as a drug that's effective for COVID, when we know that research is not showing that. Bolsonaro, it's using the same approach, exactly the same approach. And this is also a topic on the reopen schools. And one of the things that it's for us education reporters quite important to have in mind is that bringing a discussion so complex like open or not open schools in this moment, bringing this discussion to the table in such a polarized political society, this is really a big challenge. I mean, I'm pessimistic in the sense that many of the audience that we are trying to reach, we will not be able to reach, even if our stories will be well done, well prepared. They will, because people want to hear what will confirm their views, their confirmation bias. And this is something that, for instance, if we show a study that says that reopen school is safe wherever, instantly people will say, look, this is something that proves that I'm right. And I think, and like a suggestion that I think we can share with other reporters is that we have to know how to report the studies that are showing that open schools are safe or not. And I can give a suggestion from a material that EWA have done, an excellent material that we translate in Brazil at our Jeduca about how to make sense of education report. I will try to put here on the chat after, but you can just by Google, you can find easily. And it's what's one of the messages of that guide is that transparent studies, research that are high quality, they tell the limitations of the study. And because we are now in a situation where scientists are on a rush to publish their papers, their research, which is a good thing, it's a necessary thing during this pandemic, but the problem is that many of the researches that are being published, they have a lot of limitations that we should be aware as reporters, and we should report this to our audiences. So reopen schools, for instance, there's so many. It's a complex issue with so many. It's not only a matter of yes or no, but it's how. In these situations, the countries with this situation of this kind of approach has this result, and we still need more evidence. So we are covering a story that is brand new. We don't have like for other things in education research where we are pretty confident about some some things. In this case, we cannot be pretty confident by looking to the research because the research is brand new. So I think we have a big issue, and we have to reflect a lot as reporters on how we report that, knowing that in many audiences, they do not want to understand the complexity. They want to pick the evidence that will fit on their vision of the world, and that will be used for the political agenda of a group A or B. This is something that we are seeing in Brazil, and I know in the United States also, probably other countries also.
Thank you. Yeah, that's certainly an issue in the US. And thank you for plugging that was the Making Sense of Education Research, a reporter's guide that we produced a few years ago. Also, to another issue you raised around, expertise, we had a webinar last week with a pair of prominent public health experts in the US to kind of field any number of questions about, how safe is safe enough to reopen schools. And, there's so many complex issues that you can kind of unpack. But for any journalists out there, identifying some public health experts in your country or community is a really great source that you want to come back to over time. Obviously, there's the questions now, but also when, schools that are closed, at some point, what's the threshold to decide that it's safe to go back in person, and what does that look like? Or what happens when, a few kids, are infected, et cetera. So having that expertise at the ready to tap and to, foster those relationships with experts, not just in education, but also in public health, you can kind of call at a moment's notice when you want to get a comment or some insights to contextualize what's going on. Emiliana, one thing you mentioned in the conversation, and I want to say in about 5 minutes, we're going to go to the Q&A. Actually, let me give a quick plug for that again to encourage the audience to, if you're joining us from Zoom, submit your questions on the Zoom chat, which you'll find in the menu options below. If you're watching from Facebook Live, please post your questions in the comments below the video. But Emiliana, one of the issues that you raised, this is obviously huge, is the issue of inequities. I mean, I think we all know COVID-19 has underscored and even inflamed inequities in education in the US and around the world. And can you talk about some of the most profound ways you're seeing that, and ways, to get at it in maybe in specific ways that a reporter in one country or community or another could kind of look, at a dimension of how that's manifest?
I'll do my best. So one of the exercises that we did was try to understand how, what were some of the ways in which students are engaging with distance education. And what we see is that, in about 90% of high-income countries, there's online offering. Of course, we can't guarantee that it's of high quality. And we know from conversations with some of the industry leaders that there's also a lot of inequality in how much, even with households that have connectivity, how often and how regularly students are connecting, because the situation in households is quite different. So some households may be able to have a device per student, may be able to have parents who can help students. Other households may have one device that they share across the family, and parents may have to use it for working. They may need the older kids in the house to help look after younger kids for the parents to work. So there's a lot of inequality just in the access to devices and to technology, but also in the structure of the home and the types of learning environments that are available. And I think that is, we know that in poorer countries, there are more multifamily households and less availability of spaces and devices. But it's also true that even in very wealthy countries like the United States, there are communities that are facing the same issues. And so I think that's something that reporters could really look into. And then another big source of inequality, and Antonio alluded to this, has to do with just the regular investment per pupil in education. There's a lot of variation across the world. There's a lot of variation within country. And the COVID pandemic is affecting not just the health, the health industry, but also the overall economies. And it's resulting in a fiscal crisis in many countries. So a big concern is, what is going to happen to availability of resources to address the needs of education systems, around the world. We see that also in the United States. And I would say that was kind of the driver of that letter that Chika was referring to, that former Prime Minister of the UK, Gordon Brown, led, and I was privileged to be invited to sign and was happy to do so as well. But what we're really is trying to highlight the need for the multilateral development banks and the wealthier nations to contribute more resources to alleviate these types of risks to education investment, because we know that countries across the world have made a lot of progress in increasing investment, increasing access. Chika alluded to this in Africa, but that's true also of Latin America, of the Middle East and North Africa. And this, this crisis really presents a threat to the progress that has been made.
Thank you. I know we've seen in the US too, another dimension of this is just how schools very often play multiple roles, including providing, healthy meals to children for free and that sort of thing. And I know some communities in the US sort of tried to find other ways and have continued to try to find other ways to distribute meals and so forth. But, that's another kind of angle or story that you can do about, what's going on in your local community. Are they trying to replace some of those services? I know some schools even provide some types of healthcare services, and they would have a school nurse or some kind of community health facility. So there can be other types of impacts from that. Let's see. So I want to then go in and ask each of you, maybe we'll go to Antonio first. Can you identify a couple of, 2 or 3 story ideas for journalists that, in almost any community, there's a powerful and important story to tell, and maybe it's an underreported story. What springs to mind for you?
Yes. Well, I think also we have like Chika, when she made showed the example of Kenya, and of course this is a pandemic that's quite it's a tragedy, but I think not only Kenya or Nigeria, we have also to look to innovation, as I think this is something that has already been told here, but I want to address that also. And by innovation, it's not only the use of technology. For instance, in some schools in Brazil, some school principals are using the students as resources to go to try to find other students that are missing schools. So you are mobilizing. So many in the whole world, people are using cheap technology, WhatsApp messages to try to engage students. So I think we also have to look to those also more, not only big technology issues, but also small innovations that educators are finding on environments where resources are not quite big. And also another point which
actually, can I just chime in on that? Is I really love that idea and that example. We elevated at our recent event some young people who are really showing agency and trying to meet needs in their community, so that you can fall into the mindset of students and young people as victims of a terrible situation. But there are really inspiring stories, and young people can be extremely resourceful and want to make a difference. And so finding those examples and elevating those, we've seen some great stories, and I'm glad to hear what you're describing. Sorry, go ahead.
There's a lot of, no, I'm so thank you. There's a lot of potential. That's the point. I mean, the students are not only the recipients of of what educators are doing. They have potential, and educators have potential, and it's not only a matter, of course, resource matter, I'm not saying that, but even in situations where you find some, most of the districts in Brazil, you can find innovations with low, with not necessity of big investments. And another point that I really want to, and this is, I think it's going to be a huge challenge. Also, again, Chika was mentioned, I think Chika was Quenya, the problem of youth pregnancy. As reporters, I think something that always bothered me is that it's easy to go to a school and hear the voices of students who are more affluent or who are less shy, or teachers who are from union, teachers or students who have a strong position against or in favor of something. But there's a lot of students who are shy, who are more invisible, who does not like to talk to journalists, who does not have ways of reaching media, and those are the ones who probably will suffer the most. We don't have data for youth pregnancy because of the pandemic in Brazil, but we have data about domestic violence against women. And we know that domestic violence against women is highly correlated with domestic violence against child. And we know that domestic violence against child and women is also correlated to youth pregnancy. So all these come together. We still don't as from our newsroom or from our home offices, by talking to people by chats or by WhatsApp or whatever resources that we are available now, we won't find those people. And as soon, and I think it's urgent, it's necessary to find those people, to tell the stories of children, because of, we also have a lot of research showing how important, you mentioned the health issue, but also for domestic violence, how important it is to have children going to school. Because when teachers, when education professionals, they look to a kid that is suffering, they can identify and they report to the authorities. So this is a big issue and something that we will have as reporters to work hard, because usually this is underestimated. This is not a story that's not easy to go deep, because not you don't have children willing to talk many times. Again, I will make another propaganda from EWA. You have a guide about how to interview children that we translated in Brazil. It's that can give good suggestions of how to approach, especially kids in situations of trauma. You have to have a lot of responsibility when showing a case of this. So I think those are the two topics that I think we should consider.
Thank you so much. I just want to say that I have not paid Antonio to make these promotions for EWA, but we appreciate them. Chika, before I get to you, I want you to share a couple of the story ideas that you would be wanting, could share, just so everyone knows. I do see a few questions now in the chat box. So once you give us those ideas, then I'll pivot and turn. There's a couple of interesting questions here, but go ahead, please.
Sure. I would say I would like to look at budgets, federal allocations towards health and education. I think that this entire pandemic has shined a light on money and what money is being used for. And when it comes to African governments, unfortunately, health and education tend to get the lowest allocations. Compared to the US doesn't actually spend a lot on education. It's about 4%. Correct me if I'm wrong, but from what I understand, it's about 4% of the federal budget in the US goes towards funding primary schools up to secondary schools, high schools. And it's about a bit higher in African countries. Nigeria spends about 7%. Rwanda is actually about 10%, which is pretty high. And Kenya is about 4% as well. But there's not enough funding as far as what happens on a rainy day. like what we're seeing right now. There's nothing like that. And also with health spending, health is even lower. It's about 5% across the continent. And as we can see, this is literally not enough. It's just not enough. And, you know, Nigeria hasn't yet talked about the date for when schools should resume, but they've put out a guideline just a few days ago on what should happen before schools open. And some of the guideline requirements are, quite frankly, unrealistic. For example, they're saying that schools need to make sure that they have access to ambulances. That's almost impossible in Nigeria, because in Nigeria, people usually have to pay the ambulance to come and pick them up if they've got an emergency. You know, if I am in labor, or if I've chopped my arm off, I have to pay the hospital to bring the ambulance. So now trying to say that all schools have to make sure that they have access to an ambulance is just, quite frankly, unrealistic. It's impractical, and everybody knows that. I think they're just trying to follow international protocols, but how does that actually happen on the ground level in the context of Nigeria? And also they're trying to say that schools have to make sure that they have hand washing stations. It sounds so simple in the first world, but in Nigeria, a developing country, I mean, hand washing stations are still not available everywhere. I mean, you've still got many communities across Nigeria, across Africa, that don't have access to proper toilets, you know, with modern day plumbing. They're still using outhouses and pit latrines. And this obviously exacerbates a situation like the pandemic. So again, this all goes back to the need for vital funding to be pumped into education and the health sectors, especially funding to help prepare for emergency situations like the one that we're seeing in. So those are the two stories I would really like to look into. And I would suggest others to look into as well, just funding in their own countries.
Yeah, and funding is such a complicated issue. I know in the US, it's this complicated stew of federal, state, and local dollars, depending on where you live.
Right.
And even you'll see huge disparities sometimes from one school system to the next door school system.
Right.
I'm going to go ahead and throw in two other story ideas or topics to drill down into. One of those is special education. You know, if this is a population in every country that has, you know, special needs, and the needs vary widely depending on the circumstance or the disability that a student may have. We did some work on this at our recent conference, and there's so many important stories there about how are schools meeting those needs, what are their plans to address them. There's even, in some cases, been some lawsuits and legal action around, you know, what are the requirements and so forth. So there's so many stories that you can tell about these students. Even just this morning in our country, I heard a story in the NPR about this very topic from Corey Turner, which was, you know, getting at, because the needs can be so different from student to student. And in some cases, remote instruction just does not work for students. And so how are systems responding to that, even if they're not, you know, offering in-person instruction? So there's all kinds of stories to tell. Another story I saw this week from USA Today that was really interesting and troubling had to do with public reporting of COVID-19 cases by students and faculty. And how some places were publicly sharing that and others were saying, no, this is private information and we're not going to make it publicly available. So you may want to be asking in your communities for that data. And if they're not providing it, ask why, because I'm sure a lot of families would want to know what the situation is with their local schools. So one of the questions that we have is asking, the person notes there's been research showing that younger children under age 10 are not likely to spread the virus, while older children, you know, the chances of that are higher. Are there any efforts to bring younger children back to in-person learning while keeping older children at home? I can tell you in the US, I have heard of some places who tried to do some prioritizing based on that. Although I don't know that there's a lot of that going on. Systems tend to like kind of to systematize it across the board. So I don't know that there's a lot of that, but it's a great question. And I wonder if we're going to start seeing more of that, because it does seem reasonable to think, well, maybe it's safe enough to allow smaller groups of young children. Emiliana, go ahead.
Yeah, I just wanted to add with respect to that question that some of the countries that opened already, in particularly the Nordic countries, Finland and Denmark, did roll out and start with the younger students. Mm-hmm. And the argument was both what you're saying that there was at the time, and this was in May, June, emerging evidence that the younger children were less likely to transmit it and importantly, less likely to get severely ill from the virus. But also that it's harder for younger children to learn remotely and be, you know, even if they have access to a device and online learning, they need a lot more support and more active pedagogy and a more active school experience. So for both reasons, I think it's reasonable to stagger the learning, the reopening, starting with the younger children.
Mm-hmm. Antonio, Chika, have either of you heard of examples of this where younger children are getting some kind of prioritization in terms of some in-person experience?
No, not in Brazil. I think we are, we also look to this research, but again, there is a mixing. Some researchers are showing in one way, others in another way. So that brings to the issue of the complexity of how to interpret those research. And but even with the best research available in Brazil, we are facing the fear not only of teachers but also of families to send them to school. Mm-hmm. So there is a discussion that we should put first. Some states are allowing first. Are thinking of allowing first. Children of small ages, but this is not, I would say that's not it's far from consensus in Brazil. And I feel that we still need more evidence to be more confident on, because we also have, of course, we have the situation of the young children, but we also have the situation of young youth people from 16, 17 years old who are next to do their examination entrances for universities. And we also have to discuss, well, they need also urgency on the pedagogical perspective. They have a urgency because for small kids, they could have more time to recover the loss that they are facing now. But for some students at older ages, this is not an option. So this is also, that again, just show how complex the issue is.
Mm-hmm. Another question we have, which I've been thinking about this some recently too, so I'm glad that it was asked, is about communities who might come up with tailor-made solutions to continue some form of in-person educational experience, perhaps using large communal, outdoor spaces for short gatherings. Can anyone point to examples of ways that, even if it's not a full-time situation, like some kind of way for humans to actually come together with, teachers and students in a way that might be safer, deemed safer than in traditional school buildings?
From the Danish experience, when they decided to reopen, they reduced the total number of students per group, but they also did a lot of effort to use communal spaces like parks and museums and libraries that had been shut down anyway, now to open them to the public and dedicate, for example, certain hours during the school day hours. Community parks were not open to to all the community members, just to students and teachers. So yes, using other resources to be able to incorporate more students into the system without necessarily putting them all in the same school building at the same time.
Mm-hmm.
I'm also seeing a few examples. I would say community radio is playing a role in some communities across Africa. I would mention Uganda, South Africa, and some of the other East African countries. They're trying to employ community radio programs, sometimes 3 days a week for learning, just bringing young people together around the campfire to, just to follow up on the education. But I would say in terms of physical meetings, even in the case of education. I think many people across Africa are really just alarmed because while COVID is going down in many countries around the world, in Africa, it's actually rising. We're seeing sharp, steep rises, and there's still a lot of uncertainty how to bring it down because the hospital systems are really not adequate enough. So there's a general fear, a real fear. So young people are actually guarded even more than the older population, the young adult population. So parents are really keeping their young kids in the home. And so radio does work as a better option for parents to make sure that their kids can at least stay active, keep their minds active. There are some teachers who are using the local, not just radio, but TV stations as well to broadcast educational information as well.
Mm-hmm. One other thing, Emiliana, I'm curious about, and I know you've done some look into Finland and Denmark and some other countries that have, already had some experience with opening. One of the things that I read about in a news story was this idea of kind of like pods where you would have small groups of students who would kind of go together either from class to class. And that way, if there was a student who got COVID-19, then just that group of kids would self-quarantine for 2 weeks rather than shutting down the whole school. Can you tell us a little bit about that and any other kind of early lessons from places who have reopened about how they've tried to do so and whether they feel like they've successfully been able to make it succeed?
Sure, I'd be happy to. So yes, both Denmark and Finland were very strategic about how to keep limit the chances of exposing teachers in particular and also students to the infection. And so by creating those kind of pods where a group of students only sees each other during the school time and only interacts with one teacher. If any of them get infected, it allows, it doesn't imply that you have to kind of close down the entire school. And that proved to be quite effective during the period that they reopened in the spring of last year. They didn't see a rise in cases. Other things that we saw that I think are important, perhaps, one key issue was that when they reopened, they gave both families, parents, and teachers the option to not return physically to the school if they had conditions that would put them at higher risk of, getting severely ill, or if they had family members, in the case of, some students who may have an elderly grandparent living with them, that they could bring the disease to. So I think that eases some of the tension that Antonio was talking about, and that we're seeing also in the United States about parents, not trusting so much the system. And there were a lot of other health and high sanitary precautions put in place, as Chika was saying, extra places to wash hands, required times during the day when students have to wash their own hands and also clean their learning spaces. Interestingly, in Finland, they did not require mask wearing, particularly for the younger children, because they felt like it was going to be too hard to enforce. But other countries like Uruguay have done it and have been able to sustain their reopenings. The other thing that I've seen is, we were talking about bringing the younger children first back to school, and that's one option that many countries adopted. Uruguay adopted the option of starting in rural areas where the population density is smaller, and then gradually reopening schools in urban areas. So that's another option, and also did it by level. So starting with the primary education level and then moving on to secondary. So there's ways, and I think that the key thing has been that in these countries, unlike both the United States and Brazil, there is more of a centralized policy making for education and for health, which allowed them to coordinate very closely between the school system and the health authority to provide really kind of uniform guidelines. But then there was autonomy given to school leaders and communities to adopt those guidelines. You know, there wasn't like one date when they all needed to reopen. There was a date when they were encouraged to reopen, but if a school system felt they weren't ready and they weren't able to have all the guidelines in place, they could delay, and that was accepted.
Mm-hmm. Okay, great. We're just about out of time. I'm going to ask Chika and Antonio, and just to give you a quick heads up, I'm going to ask each of you to see if there's any one last piece of advice you have for fellow reporters. And while you're thinking, to give you a second, I'm going to re-emphasize a point that each of you made that I thought was really valuable. Antonio, you made the point about, you know, going beyond the quote, what we call the usual suspects, you know, the easy to find voices who get quoted and are easy to quote and easy to find, but may not tell the whole story of a community. So finding those students and young people, you know, whose voices are often left aside, and even, you know, with educators and parents, you know, reaching out, you know, and you know, still social media, there are you know, evolving ways to kind of do that, and we have some resources too about, you know, strategies and techniques to help find those voices. But that's so important, I think. And Chika, the point, I just really appreciated the way that you were focusing, as we discussed earlier. You know, there's obviously a lot of distressing and troubling stories, but also not forgetting to also shine a light on the creative and innovative things happening as well, to not lose sight of that and the human spirit at work and kind of trying to address things. So do either of you have any other last parting words for the audience on this?
I would just like to advise my fellow reporters when reporting on this pandemic, especially in developing countries, I would say it's so important to get on ground into the communities, because the stats from the federal level, it may not be a real portrait of what's happening on ground. So I would say get into the tertiary hospitals and also the primary care facilities. That's really where you're going to get a lot of stuff. And also just go to the communities. If you have to talk to the local chief, the woman's leader, the youth leader, you know, that's how societies are usually organized in Africa. There's usually a woman's leader, men, things like that. So it's best to get the information from there as opposed to the government sources, because that's where you're really going to see a lot of things happening. You know, we're seeing, for example, mortuaries completely full in a lot of hospitals, yet the government would say, oh, everything is fine. So who's dying? You know, so I would just say to remember that. And speaking on innovation, I'd love to point to, I'll probably share a link, BBC put out an article on 10 top innovations coming from Africa during this pandemic. And it's really cool stuff. And again, it just goes back to how when under pressure, human beings usually, you know, come to light with all kinds of unique innovations. So this is really an opportunity to shine a light on that ingenuity.
I love that. Thank you. Antonio.
Yes, besides agreeing 100% with Chika, I also would add that right now we are too much focused on health issues on education. Washing hands, distance from students, using masks or not using masks. Of course, we should never lose also the focus on the pedagogical issues. What will be the strategies that the systems will make to recovering learning losses, health, of course, losses, emotional losses, but also the learning process. This is a quite important thing that we should not lose on, because of the topic is quite hot now. It's this one of how to return safe on with the health situation. But let's not lose focus that we are talking about a pedagogical situation, of course, because it's schools. And yes, just adding more to what Chika said, we should not lose focus that there is a lot of potential that we should discuss a lot. What systems we want, education systems we want after that crisis. So putting also the agenda for the future. Of course, I've been seeing reports here and there about that, but it's meaning it's a matter of emphasis. So right now, if the emphasis is a lot on the health issues, we have soon change the focus or the intensity to the more pedagogical issues, and for now and for the future.
Thank you. Emiliana, did you want to share any last?
I would completely second that. I think we are, you know, this pandemic has rightly so focused a lot of attention on the health and even on the financial crisis. But I think it's also the first time when worldwide a lot of students have had to engage with technology, teachers as well, and parents. And I hope that we can also focus on what are some of the, you know, transformations that were so hard to introduce in the past that maybe now we can really embrace across the world to make schools more engaging and more kind of 21st century than they have been in many of the developing world in particular, but also in some of the advanced countries.
Okay. So with that, thank you so much to our speakers. This was really great information. And to our audience, thank you as well. I hope this webinar inspires you to take up this kind of reporting and education where you are during this pandemic. If you're not a member of the ICFJ Global Health Crisis Reporting Forum yet, I encourage you to please find the group on Facebook or get more information about the forum on www.icfj.org. Please don't forget to fill out a survey coming to your inbox after this webinar. ICFJ would love your feedback to improve programming for this series. That's all, everyone. Thanks.
Thank you. Bye-bye.